All right, guys, here it is, your last chapter in this class. I hope that you've learned a lot, and I hope that you take this information and you're able to use it in your career and in your personal life as well. And so let's talk a little bit about mental health diseases and disorders. This book gives very little to this, but you guys are getting a lot of this in other classes. So I don't want to overdo it, but let's talk a little bit about common signs and symptoms. This is typically going to begin with behavioral changes. It can be very subtle. It may not be noticed in early development, but you can have temper tantrums, anxiety. They can do some tests, but there's not a lot that are going to show us this. I wish that there were. I wish that there was a test like for diabetes where we could run it and say, oh, yep, you got bipolar disorder, or oh, yep, you've got schizophrenia. There's not, but hopefully someday there will be. They're going to get referred typically to a psychiatrist or nurse practitioner for testing. And that testing is more personality tests. These are pen and paper kind of tests. Intellectual disabilities are often the cause is unknown. It can be genetic or acquired. Symptoms may not show up until they get into school, but they're going to have a decreased ability to learn and developmental slowness. And there are fetal alcohol. You can't always prevent this. Some of this is just hereditary. There are some things that you can do when you're pregnant to help avoid this, but typically there's no prevention here. ADHD is going to be characterized by the inability to concentrate, hyperactivity, impulsiveness. This can be hereditary. And they do use amphetamines and behavior modification. There's other treatments as well. Eating disorders we've talked about, so I'm not gonna go into that one too much. Tic disorders or sudden rapid muscle movements or vocalization. It can include many different things. My niece had a tic, and hers was that she would like that in front of a lot of her sentences. Enuresis, and there is encopresis as well. Enuresis is just urinary incontinence after the time of toilet training. So when a child is toilet trained and they're still bedwetting is enuresis. Encopresis is when they're having bowel movements in their pants after they're toilet trained. There are some common terms: addiction, dependency, tolerance, and withdrawal, but give it time. They're changing all of these to make them more friendly, to make them not sound quite as bad, but most people still use a lot of these terms. Alcoholism or alcohol use disorder is just a dependence on alcohol. It can be chronic, and it essentially can kill people. Marijuana can give a euphoric effect. There is fake weed or K2. Cocaine is one of the most addictive drugs. It's going to be it's a stimulant and an anesthetic. People like it. Methamphetamine is the fastest growing abused drug today. It is an addictive, potent central nervous system stimulant. Caffeine and nicotine are the most common addictive substances. These are stimulants. How many people in this class could go without caffeine? I don't know that I could. I'd just get a caffeine headache from not having it. Sedatives or depressants, anti-anxiety medications, amphetamines, hallucinogens. You guys should have went over all of this in your BHS 230 class. Narcotics, inhalants, anabolic steroids. Organic mental disorders can be associated with a physical cause. They can affect cognition and ability to think, make judgments. They can be temporary or permanent. Some include dementia and delirium and Alzheimer's disease. These are hard to differentiate, and they're usually a sad thing. Psychosis is a disintegration of one's personality and a loss of contact with the reality. This is also super sad when I see people who are in active psychosis. They don't know what reality is versus non-reality, and it's very difficult for them to choose. I had one gentleman who would tell me, he'd say, He thought that there were people that could read his mind and that they were like psychics off of TV. And after he came out of the psychosis, he was like, can you tell me, like, kind of like Hunger Games? I don't know if you guys have seen that movie where PETA was like, is this real or not real? And that's kind of how they feel. They don't know the difference, even when they've come out of that psychosis. Schizophrenia used to be called split mind. If you guys haven't seen the movie A Beautiful Mind, I would encourage you to. It's a great movie based on a true story of somebody who had schizophrenia. It is serious. It's not split personality. They do lose touch with reality and they act on their imagined or fantasized realities. We do have treatment for this. There are delusional disorders. This can be a firm belief in a delusion in an otherwise normal, adjusted person. And there are different types. I have seen this a few times. I had one patient who had persecutory delusions, and she believed that her husband was out to get her. And if I didn't know better, if I didn't have people coming in telling me like these things are completely false, he's not poisoning her, he's not doing this, he's not doing this, I would have absolutely believed every word that she said. She was very, very convincing. Depression is a prolonged feeling of extreme sadness, unhappiness, despair, or discouragement. I usually tell people everybody has times in their life where they're depressed or sad, and everybody has times in their life when they're anxious or worried. That's normal. I don't really like the word normal, but that is normal. It's when they become prolonged and they impact our functioning that it becomes a problem. Seasonal affective disorder is a depressive condition during winter months, very, very much a real thing. Bipolar disorder used to be called manic depressive. They have extreme depression and then extreme mania. We do use mood questionnaires to help identify this. Dissociative disorders is an escape of reality. In involuntary or unhealthy ways, they're going to suppress memories and assume alternate identities. I've only seen this one time in my career. There are different types there. Anxiety is usually a temporary response to stress and can become chronic. It may be related to genetic factors, stress, biochemical alterations, and in some cases there's a physical cause, like hyperthyroidism can cause anxiety, and that's not because of, I guess it could be genetic, but it's essentially this physical cause that the body is producing too much, and it causes people to be anxious. There are different types of anxiety disorders. Sometimes I think that one person can have multiple types, and usually OCD is a type of anxiety disorder, but can go along with generalized anxiety disorder. Somatoform disorders are physical symptoms but no cause. We don't really know why they're having these physical symptoms. They can have conversion disorder. I've seen this once in my career too. Hypochondria is an abnormal anxiety about your body or health. And then pain disorder, which the pain doesn't have a cause, but they feel pain. Malingering is a false display of symptoms for their financial or personal reward. Munchausen syndrome is the simulation of illness for no other reason than to receive treatment. Springfield, Missouri made that famous. I forget what the little girl's name was, but she killed her mother, and they've done all sorts of movies and shows about it. Or actually, it was her boyfriend that killed her mother, I think. Munchausen, and that was actually Munchausen's by proxy. It was the parent projecting the disorder onto a child. Personality disorders develop early years of life, and they're affected by genetics and environmental factors. There's different types, and these antisocial is what we think of when we think of like mass murders or people who, serial killers. Sometimes we think of them as having an antisocial personality disorder, not always, but a lot of times. Borderline, they don't have that up there. That's a common one in some of the people that we see. Different sexual disorders, we're not going to go too much into this, but they are out there, and We do see them, and so just be familiar that there are some of these out there and you may hear about them. Sleep disorders, there are different types. Some of these can be more severe than others, and sometimes people will have can have one or more of these. And just keep in mind that the level of what some people may have may be minor and other people may be severe. So sleep tears can be severe for people, but sleepwalking, some people may only sleepwalk when they're really, really tired, and then other people will sleepwalk quite a bit. I hope that makes sense. There is trauma related here with grief. Grief is normal. It is a healthy process. People do grieve differently, but keep in mind that it is a natural process that we don't want to block. Some people who lose a loved one or an animal that they were really close with or a child, they come in and they want me to medicate that, and you shouldn't. Temporary things to get through a funeral or something like that are okay, but long-term treatment is more of a therapy-based instead of a medication-based treatment. Again, we've talked about suicide. It is a major concern and risk factor for teenagers. Many of these disorders can affect the older adult. They can have different symptoms here. It is important to distinguish if it's a mental health problem or a normal process of aging. And a lot of times they're going to have depression, insomnia, isolation, and medications can also cause symptoms of mental health problems. When my grandmother passed away, my grandpa had went into a full-blown, like almost manic state, and he was depressed and didn't know what to do and ended up having to be hospitalized. It was very interesting. Somebody I'd seen my whole life never have any problems, and then all of a sudden becomes almost manic. And he lived out his last years being just fine, but he ended up right after, probably 3 months after her death, being hospitalized in the psychiatric unit. All right, guys, that's the end of your text. I hope that you've learned a lot. Please post any questions that you have, and I'd be happy to answer them.